and welcome to The Art of Conversation, a radio show dedicated to a college course dedicated to the art of conversation. This program is brought to you by the Eileen G. Jones Honors College and the Department of Communication Studies, Media, and Journalism at Commonwealth University here in Bloomsburg, Pennsylvania. I'm your host, Eric C. Miller, Professor of Communication Studies. This show is the official radio presence of Honors 211, The Art of Conversation, a course that focuses on the ancient art of dialectic, that is, the collaborative process by which knowledgeable peers pursue the truth through focused question and answer, back and forth, what is often called Socratic discussion. After a few weeks of wading through the theory on these matters, our students spend about 10 weeks in practice, holding twice weekly 75-minute deep dives into topics and questions of their choosing. Our theme this semester is the good life in the Great Acceleration, and all of our content falls somewhere within this intentionally wide umbrella. Each week, we're talking about how to live good lives in this era of soaring economic growth, technological innovation, labor market uncertainty, political turbulence, climate change, mass extinction, and on and on and on. My guest today is Dr. Luke Semrau, Assistant Professor of Philosophy here at Bloomsburg. Dr. Semrau holds degrees from Whitman College, St. Joseph's University, Tufts University, and a PhD from Vanderbilt. He arrived at BU in 2020 after a 2-year fellowship at Georgetown. He is an ethicist, and much of his research has focused on the ethical questions surrounding the creation of a legal market for the sale of human kidneys. It's a fascinating possibility with clear relevance to the question of good living, especially for the tens of thousands of people currently awaiting a kidney donor. Dr. Semrau has visited our class to discuss this matter several times in the past few years, and I'm grateful that he has taken the time to join us today. Dr. Luke Semrau, welcome to the show.
Thanks for having me. Glad to be here. Glad to talk about this important and consequential topic.
On that note, let's start with the basics. Tell us a little bit, what is a kidney market, and why do you think that we need one?
So unlike pretty much any other organ, we've got two perfectly adequate kidneys. One would be fine. We just need one. We've got two. Yet there are a relatively small number of people, but in absolute terms, it's a lot of people that don't have any kidneys. So they're suffering on dialysis if they're lucky. And the problem is, I guess, like proportionate to the entire population, it's a pretty small number, but in absolute terms, that small number is still significant. So the number of people that die each year because there are fewer kidneys than would be ideal is, estimates vary. Really low figure is going to be 10,000. Higher figure is going to be 70, 73, 74,000. So that's a lot of people. It's a lot of people that need a kidney, and their lives could be dramatically improved if they had one. At the same time, we've got 300 million people in the United States alone that have an extra kidney. They're not using it. They're not benefiting from it. So why not facilitate this transaction where the person who needs a kidney gets one from the person who has an extra they don't need? So mutually beneficial transaction seems like a great idea. We've got a bunch of people that would benefit, buyers and sellers, so we should pursue it.
So under the current model, we have to wait for people to make a donation out of the goodness of their heart. Most people will not donate a kidney to a total stranger, and so you basically have to hope that somebody in your family is willing to give you one. Why do you think that selling kidneys would help provide the kidneys that people need?
I don't know, maybe 300 or 400 people a year at most donate a kidney to a stranger. So people just, in general, aren't willing to undergo this tremendous burden for a stranger. Now, if it's a family member, then they might. In the same, like people pay ransom because they don't want a family member to die. People donate kidneys because they don't want a family member to die. That's why they do it. If we aren't threatening the lives of a loved one and we're not offering them money, then they won't donate a kidney because you have to get cut open and you might need that kidney later. You might like surgery. It's not risk-free. There's some pain involved. Then you might worry about not having this kidney that in the future you might have wanted. So there are good reasons why people don't want to undergo this procedure for nothing. So the status quo, we wait until their family member is sufficiently sick that they can no longer tolerate it, and then they donate. Or there's nobody available to donate, or that the people that are available decline to donate, and then that person just dies. So if we offer nothing, then they won't provide a kidney. If we wait until a family member is going to die, then they will. And we're kind of taking that strategy now. And it's just not a very efficient one. That's why the figures I was mentioning earlier, between 10 and 73,000 people a year dying for want of a functioning kidney.
So how would the process work? If I need a kidney and you've got a kidney to spare, do I just make you an offer, pay you as much as I can afford, or is there some other means?
Yeah, great question. So there's lots of different ways that you could arrange a market. And what you just described, I think there's a lot of ethical questions that would be raised by that, lots of problems that might need to be solved. But markets don't need to be organized in that way. You could have a highly regulated market that doesn't differ too much from the present arrangement now. So rather than having buyers and sellers come together to determine price, we could just have a fixed price. And rather than having the person who needs a kidney paying for the kidney, we could have the government provide a kidney. So we'd have a monopsonistic market where there's just a single purchaser, and that's the government. And they buy kidneys from people that are sufficiently healthy and suitable donors. So they buy the kidneys, they pay those people for their kidney, and then they distribute the kidneys to people that need them on the basis of medical need. So that is still, I'm happy to call that a market. That would have the intended effect of increasing the supply of kidneys without introducing the problems that arise when we have prices being set by supply and demand, or when we have the sort of concerns about distributive justice that might arise if a resource that now is not distributed according to ability to pay started to become distributed according to ability to pay. So lots of different ways you could arrange the market. I think that the prudent thing to do, especially in trying to persuade people that we should pursue this policy, is to look for a tightly regulated market that includes all of the safeguards that we have at the moment for donation. So, of course, people need to be sufficiently healthy, and they need to be voluntarily consenting. All of those safeguards that are presently in place would remain. The only difference is the person who's getting cut open would get a bunch of money. And that seems like reasonable compensation for them, and somebody else's life is saved.
So basically the government then is the middleman. The government is always in the market to buy kidneys. And so people who maybe have a spare kidney, they're in good health, they could use some money, are able to sell that kidney to the government, which then makes it available for free to somebody who is in need of a donor. How much would the government pay me for my kidney under the plan?
So that's a great question. And I guess I do want to mention that under the status quo, the government spends some $70,000 to $90,000 a year for each person who's on dialysis, which is extremely expensive. It's far more expensive for the government to continue the current policy, which is to pay for dialysis, than it would be to buy kidneys. Recent estimate has it that you could pay $335,000 for a kidney, and you would still be saving money compared to paying for dialysis. So this proposal not only provides kidneys to people that need them and provides money to people that prefer money to their kidney, it also saves the taxpayer a bunch of money. Now, the question you started with was how much would I need to be paid, or how much would I pay? Now, I think the reasonable figure is $100,000. That seems sizable, and it's also like round and simple and attractive, and is sufficiently large that we, I think, plausibly could expect it to significantly benefit the recipient, the person who's getting it. This is not a pittance. This is some money that I think it's reasonable to expect to dramatically improve the quality of their life. So that number seems like a good one to me. Other figures that have come around, $50,000 is being, so there's legislation in Kidney Deaths Act that is being considered now. I think maybe they're trying to reintroduce it back into Congress now that we've had this change. And the incentive there would be 5 years, each year $10,000 tax refund. So that would be $50,000 spread over 5 years. That still seems like that is better than nothing, and I think a lot of people would find that attractive. I guess I'm a little bit inclined to pay them more. A lot of the concerns that people have about kidney sales are predicated on the assumption that the sellers are receiving very little money. And I think a lot of those objections are harder to sustain when we're offering them so much. That $100,000 figure is far and away greater than what economists estimate the market clearing price would be, which they put that somewhere around $15,000. So assuming that figure's right, the kidney seller is getting $85,000 gift for saving somebody's life.
Okay, so in sum, because I think there's a lot of stuff going on here, we have a problem in that there are tens of thousands of people who need a kidney who can't get one because they don't have someone in their family maybe who is able to give them one, and a stranger is not inclined to give them one because the stranger would have to undergo some real, sacrifice in order to do that. And so the proposal here corrects the problem by paying strangers to donate their extra kidney to help somebody in need. Maybe we would all like to think of ourselves as someone who would be willing to make that sacrifice to save someone's life, but we're mostly not. And so this means of compensating donors would help satisfy the need for kidneys while also adequately compensating those who are providing the kidneys. And so it seems like a win-win situation. Given how expensive it is for the government to pay for dialysis through programs like Medicare, for example, paying somebody a flat $100,000 fee for the donation of a kidney would be cheaper, and it would be a life-changing sum of money for that person, and somebody else would get a kidney, and it's all great. Everybody wins, money is saved, et cetera, et cetera. What are the primary objections to this plan from those who have a problem with it?
Where to start? There's a lot of objections, and they're of varying degrees of plausibility. So one kind of objection says, well, kidney donation needs to be altruistic. You need to be motivated by altruism. It can't be a financial transaction. And there's lots of problems with that. So do you want a list of objections, or do you want an objection and an elaboration?
Maybe like an annotated bibliography of objections, just a little bit maybe about each one.
Yeah, so altruism. Altruism's great, and we like to live in a world where people do nice things for strangers. And maybe there's an argument in favor of blood donation rather than blood sales that appeals to altruism and social solidarity. So there's that kind of argument. One kind of argument says, well, that's commodification. The attitudes that we take towards people and kidneys would be distorted in troubling ways. We have commodified the human body, and that's bad, so we should refrain from having a market. Common objection, well, exploitation, we would be exploiting the poor, lots of different ways to fill in the details of that kind of concern. Coercion, this is different from the exploitation objection. Coercion, that these people in poverty, they're almost coerced, maybe coerced by their economic desperation, so their consent is invalid. Concerns about quality of consent. Is it possible for somebody to give valid consent to sell a kidney? Concerns about unfairness in the burdens, the distribution of burdens. We're going to be purchasing kidneys primarily from people with less money rather than more. And it's unfair that the burdens would fall disproportionately on one economic class rather than another. Another concern is the purpose of medicine. This is about healing people, not about like improving people's quality of life necessarily, not about commerce, not about turning healthy people into patients. Kidney sales is incompatible or inconsistent with the aims of medicine. Harm. People who sell a kidney would be harmed, and we shouldn't harm people. So there's like a bunch, and maybe there are a few others that I've left out or different ways to group them. But exploitation, harm, concerns about consent, altruism, commodification, purpose of medicine, that's a lot of them.
But you don't find these objections persuasive. Is there like a concise way to dispense with them? Like, how do you respond to these objections?
That would be fantastic. A concise way to dispense. No, I think they're all terrible, and they can be clearly shown to be just utterly unpersuasive, but it takes some time, and there's the challenge. A lot of the objections can be leveled with a single sentence, or maybe two, and people understand it immediately, whereas to respond to them requires much more. To show where the inconsistency is or to highlight whatever the problem is. So I guess what I would say, though, is just to get started, we all think kidney donation is great. Virtually everyone thinks kidney donation is permissible. So for one, if you have an objection to kidney sales that also would foreclose kidney donation, that's a bad objection, right? Because you think donation's okay. Back to this concern about sellers would be harmed. Well, the nephrectomy is equally harmful, whether you're paid for it or not. If anything, you would think the person who's paid for it would be less harmed than the one who wasn't. So if you think donation is permissible, you shouldn't level objections to sales that would equally undermine donation. And the harm is one of those, right? If we think that the harm is sufficient, or it's like sufficient, the benefit is sufficiently good and the harm is sufficiently bad that it's permissible to donate, then the same kind of reasoning should apply to sales. So there's that. Be consistent with what you think about donation when you're thinking about objections to sales. And then there are all of these other cases, things that we think are totally fine, whether it's like rich people don't work at McDonald's, rich people don't have work in dangerous labor. There are all sorts of other features of our life, whether it's the distribution of like labor that I was just talking about, or risks that we think it's acceptable for people to take. And we should just try to be consistent with that. We shouldn't object to kidney sales on the basis of some consideration, which if we took seriously would count as an objection to everything else, to all these other practices that we think are acceptable. I don't know if that's quite what you were looking for. That's not exactly a concise way to dispense with all of these objections. But I think if what could be said to address many of the objections is we should be consistent, look at the other practices that we think are acceptable, and not single out kidney sales and oppose that on the basis of something that in any other context we would find acceptable.
Yeah, I think that most of the objections here rely upon some kind of, I don't know if it's a vague feeling of discomfort that people have with it. We think it's good to donate your kidney out of the goodness of your heart, but there seems something crass about selling a part of your body for money. Do you think there is something basically dehumanizing or unethical about turning a body part into a sellable commodity?
No, not in principle. I don't think that surely there's terrible ways that we could sell body parts that would be really objectionable. But I think that there are alternative ways to do that that are not so problematic. So I guess just a minute ago, I was trying to give some general advice about how to, if not concisely respond to these objections, something general that could be said about them. So here, this is relevant. We think that people can sell their hair or their plasma, indeed they do, or sperm or eggs. There's all sorts of contexts where we think exchanging money for body parts or body services is acceptable. So yeah, if you think that those things are acceptable, then that should figure into your estimation about kidney sales. I think people shouldn't be treated badly. They shouldn't be disrespected. Their welfare shouldn't be disregarded. All of those things are true and important. I think consistent with that is allowing them to sell their body part. I don't see any inconsistency here. And indeed, I might worry about what you think of my autonomy if you want to override it and prevent me from doing something with my body.
Well, it's also the case that the kidney is kind of a unique organ here in that there are two that, and you could do without one. This is not like a slippery slope that's going to open the door to lung sales or heart sales or anything quite like that, because those aren't quite the same thing. Does that make this substantively different?
Yeah, it's a miracle. It's really incredible that we have the technology, the ability. Surgery's incredibly sophisticated now, very safe, and we have this additional organ that is totally unnecessary. That's amazing that we can do that. So yeah, I think the case for selling body parts is the strongest when we're talking about kidney sales, because we're talking about something that is life-saving. It's standardly life-saving, and the cost borne by the seller is pretty low. And indeed, the more available kidneys are, as they would be if there was a market, the lower that cost would be. As it is now, if I donate a kidney and I need one later, I have to wait on the list and hope that I get one. I probably will, but I still have to wait. Whereas if there was a market, if I sell a kidney, I don't need to worry about later on needing it for someone else, or what happens if something happens to my other kidney. No, there's plenty of them. The market has made them available. So I think the case is stronger when we're thinking about a kidney than about other body parts and services.
Is there any potential for abuse here, like that maybe somebody would coerce or compel another member of their family to donate a kidney against their will just to get that payment?
Yeah, sure. Just as there is now, right? So indeed, there's a long empirical literature that documents the various kinds of stresses and pressures that donors face and how fraught that choice is. So, and there's a bunch of like infrastructure that's in place to try to ensure that donor's consent really is valid. So, they can get a note from the doctor, and the note says, you're not medically suitable, but really they're totally medically suitable. They just don't want to do it. And it's really difficult to tell that, the family member that you don't want to do it. So whenever someone has something of value that other people need, there is risk for coercion. That, of course, that is not unique to the market. That exists now. It's just insulated. It's like within the family context. So we don't see it so much. And indeed, we have so thoroughly romanticized donation that I suspect few people contemplate it or maybe take it seriously. It might seem surprising. Wait, a family member would pressure another family member into donating a kidney? Isn't this supposed to be this beautiful altruistic thing that you do for the sake of this other person? But in reality, it's a lot more complex. So is it possible? Is coercion possible? Sure. A lot of people have things of value. Your neighbors, they have cars and retirement accounts, and there's lots of stuff. There's lots of people that have stuff that you could steal, or you could threaten them, you could compel them to provide via force. That's true. Whether we should worry that allowing kidney sales is going to lead to coercion, as you're imagining, I think that depends on whether allowing kidney sales introduces a better opportunity for coercion than those that already exist. If somebody has some kidneys and I could try to coerce them to sell one and then take that money, I need to convince them first to turn their kidney into money. And that involves like a whole medical team who are very concerned to make sure that that person is really acting voluntarily. And it seems to me unlikely that that's going to work. And after I get them to do that, I then need to extract the money from them. Now, I'm not interested in coercing people, but if I were, rather than that two-step process, coerce them, make them turn the kidney into money, and then coerce them to get the money, why not just coerce somebody who already has money? That seems much easier to me. So I'm skeptical. I don't worry so much about coercion because I don't think that allowing kidney sales would be introducing a better opportunity for coercion than those that already exist.
Well, certainly getting a payout of $100,000 or more creates an obvious incentive for why someone might want to sell a kidney instead of just going through the process and donating it for free. And as you frame it, it would be better for the government too, in that it would save them quite a bit of money. I floated this to a friend of mine the other day who's a doctor at Geisinger. And one of the questions that she had was whether the cost savings would still be there after the government had to pay for immunosuppressant drugs that the recipient of the kidney would have to take for the rest of their life so that their body would not reject the new organ. Have you calculated that into the question?
Yep. All of that is considered. All of that is factored in. This is, a financial winner. The case is overwhelming. The amount of money that would be saved is so high that to be concessive, I could divide it by 10 and we would still be in a winning position here. And so far, we've just talked about like the cost. So we spend this much on dialysis and we could spend this much on purchasing a kidney. We haven't taken into account the value that the kidney confers to the recipient. And that is estimated to be like $1.3 million is the monetary equivalent of the value that the kidney confers to the recipient. So
how do they calculate that?
There are assumptions here about quality of life and how much people would be willing. So this is a great question. And here I'm trying to remember all of the details, but the main idea is we can ask people, have them compare a bunch of different lives. Some, maybe you're blind here, or your legs don't work here, or there's different quality of life. Each one of these lives suffers there's some adversity, some difficulty, and then extrapolate from the comparisons that they make or the values that they assign how much a given imposition would be. Like how hard would it be to be blind? How much would that lower my quality of life? So that's part of the story. The other part of the story, I think there's just some standard cost benefit analysis here. Like we make the same kinds of decisions when we're figuring out like, well, should we make this road? If we make it this wide, then it's going to be safer, but it's going to cost a lot more. How many more accidents are going to occur? How many people will die? And how does that compare to the cost of the road in the first place? So I think the figure that the government uses in the context I just described puts something like $9 or $10 million is assigned to the value of a life, statistical value of a life? So look, this is a great question. I don't have a great answer. I would have to go back and look at what the various calculations, where that figure is coming from.
How does it change? I know a lot of us have the phrase organ donor on our driver's licenses in the event that we would be killed in a car accident or something, and then our organs would still be useful for transplant. What's the difference between getting a kidney from a live donor versus getting one from a deceased donor in terms of the quality of the organ?
Yeah, good. So they last about twice as long. So it's maybe 18 years rather than 9 years. So you're getting a transplant much later if you have to get it at all. And there are more than enough live kidneys, 300 million plus, whereas people just don't die in the right circumstances often enough to use their organs to solve this problem. It's just not going to happen. We can do more to encourage people to become donors. We could do that a lot better. Look, that would be better than nothing, but we're never going to solve this problem. We're never going to approach the 10 to 73,000, depending on how you count, 10,000 to 73,000 people that die each year for lack of a kidney. So yeah, it's better to have a live kidney than a cadaveric kidney because it lasts twice as long.
I asked the students in the class, this is something I've thought about too, since you introduced this concept to me. What's the likelihood that you would donate a kidney to a stranger? Being honest here going forward, and pretty much nobody is willing to do it. And then when I say, well, what if you were paid $100,000 to donate a kidney? What's the likelihood that you would do it? And still a lot of people say no, but at that point, the figure of those who say yes jumps up considerably from 0 to, it might only be like 4 or 5 out of the class, but that's a very significant increase. You had mentioned earlier a bill that had been introduced into Congress that included some version of this plan. What kind of prospects do you see for its enactment in the United States in the foreseeable future?
That's a great question. On one hand, I think absolutely, because the arguments are so overwhelming. They're decisive. Everyone wins. Everyone wins. So I think about that, and that makes me optimistic and hopeful. Then again, it's also true that there are a lot of people that remain opposed to this, and they have for a long time. And I guess I mentioned earlier in the conversation, it's really easy to level the objection. It takes one sentence to say, what you're going to exploit poor people, we're going to use them for spare parts. And then to respond to that, it takes a lot more effort and time and energy. You have to have a couple thoughts. You have to be patient and hear a couple sentences of explanation. So on one hand, I'm optimistic because I think that this is such a fantastic idea and everybody wins. But that optimism is tempered by recognition of the recent history, decades of opposition. And it seems like some of this opposition is resistant to the kind of rational appeals I was just talking about, right? Good arguments. Not very responsive to those good arguments. Sometimes I'm surprised that competent, smart scholars that have been around for a long time continue to give arguments that I know have been decisively refuted, and I know that they have read those decisive refutations because they reference those same papers where those refutations feature. So that's surprising to me that people are not responding to these arguments in the ways that I would expect. So that causes me a little bit of a doubt in my own estimation. So I don't know. I'm still optimistic, though. I think 50% chance in the next 5 years that there's some legislation that maybe it's not exactly what I want, but would involve substantial kind of compensation for donors that goes beyond the meager things that are available now.
Dr. Luke Semrau, thank you for joining us on the program today.
Thanks for having me.
You have been listening to The Art of Conversation Radio here on 91.1 WHSK The Husky. This program is brought to you by the Eileen G. Jones Honors College and the Department of Communication Studies, Media, and Journalism here at Commonwealth University in Bloomsburg, Pennsylvania. As always, I am your host, Dr. Eric C. Miller, Professor of Communication Studies. Thanks for joining us today, and we will see you next time.